Hello, everyone. Welcome to the very first AGILE webinar. I'm Jing Yao, the co-secretary of the AGILE Council, and it's a pleasure to be chairing today's session. My colleague, Dr. Yang Wang, is also here to co-chair today's session, just in case my internet connection dropped off. This webinar series is a brand new initiative from AGILE, created to help our member institutions connect, share ideas, and learn from each other. Every couple of months, we will hear from different teams doing exciting work in geoscience, from geospatial data science, spatial analytics, to spatial machine learning and emerging technologies. Each session will follow a simple format: a short intro from the hosting institution, a research presentation, and then some time for questions and discussion. To launch the series, we are delighted to welcome the Geographic Data Science Lab from the University of Liverpool. Our speakers today are Dr. Carmen Cabrera and Dr. Susie Deng, who will be sharing some of the lab's work in geographic data science. Again, thanks very much for joining us for this first AGILE webinar, and I will hand things over to our colleagues from the University of Liverpool.
Awesome. Well, thanks so much for the introduction, Jing, and thanks so much to AGILE for inviting us to speak at the seminar today. We are actually very excited to be the first ones, also because we are relatively new members to AGILE. So I think that's it's over a year now, so maybe not so new, but perhaps still unknown to many of you. So let's get on with the presentation, and hopefully we get to convey what we do here at the Geographic Data Science Lab. So I'll share my screen. And can you see that? Yeah, amazing. All right, so right, so I'm Carmen Cabrera, and I'm a lecturer in Geographic Data Science here at the University of Liverpool, and today I will be presenting with Dr. Susie Deng, who's a postdoctoral researcher here at the lab as well. So I will do the first part of the presentation, and then I will hand over to Susie so she can continue. And here are our emails. I would imagine they are also on the Teams call. So of course, we are more than happy to be contacted if people have questions after the webinar, of course. Right, so who are we? We are the Geographic Data Science Lab, also known as the GDSL. And this is about 45 of us, okay? So it's a very diverse group with people from all over the world, really. It's about 45 people. Within those, we have 15 staff members who are permanent faculty. So that's lecturers, senior lecturers, readers, and professors. Many of us are, or we consider ourselves early career academics. So it's quite a youthful bunch of faculty members. And then we also have, I think it's 4 postdoctoral researchers, one of them being Susie, who's joining us here today, and then over 20 PhD students. So we have a really large community of PhD students, and we like to think that that's one of our strengths, because it's quite nice and unique atmosphere that we get here, where there's a sense of community with so many PhD students working through similar challenges and relatively similar projects where similar methods are applied, even though each of them has their own topic of expertise, of course. So most of our PhD students are funded through the UK Research and Innovation, which is a section or an agency of the UK government that funds research. And for our lab, most of the funding for PhDs, but also for many of our research grants, comes from a specific council within UKRI, which is the Economic and Social Research Council, so the ESRC. And why do I mention this? Because if you know someone who might be interested in doing a PhD with us or generally in the UK, this UK ESRC is now has open applications for PhD studentships. So we are always very interested and happy to consider applications from PhD students from UK, but also from abroad. And we also have many visitors every year, so that's quite an exciting thing of our lab, that I think any given time of the year there's going to be some people who are visiting us, maybe some PhD students doing a research stay with us, but also more senior researchers who decide to come here to maybe work on some collaborations or give some talks, in summary, to share their research, but also absorb from our own expertise. So again, why do I say this? Because if you ever consider coming to the GDSL, just to say that we'll be more than happy to host you and have you as a visitor. So I like to touch upon the different areas of academic life, so teaching, research, and here in the UK we also really like talking about research impact. So I have structured the rest of the seminar in these sections, and I will start talking about our teaching. So we do teaching at both undergraduate and postgraduate level. I should say that the Geographic Data Science Lab is a research group which lives within the Department of Geography and Planning of the University of Liverpool, and the Department of Geography and Planning lives within the School of Environmental Sciences. So our teaching is for the students, undergraduate level is for students of the Bachelor of Arts in Geography. And this program is taught together with other colleagues from our department, so Geography and Planning. But GDSL members are mostly involved in teaching the more quantitative courses of the subjects that are about human geography mostly, because there are also subjects that are about physical geography or political geography. We don't get so involved in those ones. So it's human geography, quantitative courses, and within these courses, we have things like introduction to statistics, introduction to GIS. We have geographic data science, of course, and then analysis of surveys and things like that. So that's for undergrad. But I would say our main contribution to teaching is through our masters in geographic data science. So we are the ones in charge of delivering this program. And here I listed our range of compulsory modules. So perhaps the biggest one among these is the Geographic Data Science course, which I am involved in teaching. So this is a really large course with over 100 students, where students from our master's join, but also students from other master's programs in computer science join as well. So this is why it's so large. And then the rest of courses that you can see here. I am also involved in teaching and actually leading the course on computational social science. So that's what I have for teaching. I will get back to some of our teaching materials later on when I talk about impact as well. But for now, I would like to talk a bit more about our research. So at the GDSL, we like to kind of, when we are asked, what is your research about? We like to articulate this into 4 themes. Obviously, our research is in very general terms about the integration of data science and geography, but this falls, as I say, within 4 themes. The first one being inequalities and sustainability. So within this theme, many of us are interested in addressing things like deprivation, poverty in disadvantaged communities. We are also interested in the idea of decolonizing research. So many of us are making an active effort to include in our research countries that are traditionally underrepresented in mainstream research. So, for example, recently we've done a lot of work on Latin American countries and countries in the Middle East. And within this theme, we also do address sustainability challenges. So some of us are involved in doing research where this research we do it with the hope or with the intention that is going to be informing policies for net zero targets. The second theme is urban analytics, and more particularly, we have, I would say, two main streams within this theme. So the first one is about the study of urban economics and retail geography, and the second stream is on urban form, structure, and function. Okay, so um, I have been mostly involved in that one about urban form, structure, and function, as you may see from some of my previous work. Also about changes in the demographic composition of cities and what are the implications for urban life. The third theme, and the one I feel most identified with, is the one about people, human mobility, and geographies of transport. So in here, we focus mostly on the use of digital trace data to uncover emerging mobility patterns across different scales. So from commutes within the city to migration movements. And this digital trace data, for those that are unfamiliar with the term, is data that we gather from people's interaction with technologies, such as mobile phones. So when you go on an app and you share your location, this data is recorded and then we can use it for research. Of course, it comes with lots of methodological challenges because we need to make sure the data is appropriately anonymous so the privacy of users is preserved. And it's also sometimes really noisy and hard to process data. So the methods in itself is a whole topic of research within our lab. And we also do a lot of work within this theme on investigating forced displacement, either due to climate crisis or to conflict, such as the Ukraine war. We have some colleagues that have worked on Ukraine-related displacements. And the fourth theme would be about social environment and social and environmental sensing. So this concerns human environment interactions and the use of satellite data. I will talk a bit more about this one later as well. And then underlying all of these themes, as I say, is the methods, which is something we really care about here in the lab. And some people purely work on the methods, although most of us develop methods, but more in an applied way. So we usually adhere to one of the four themes on top of working on the methods. So methods that we are currently working on is the application of machine learning, ABMs, and large language models to social science problems, and exploring, as I was saying before, non-traditional data sources such as digital traces for the study of mobility, and also the development of software, as I will also talk about later. So given these are our themes, I thought I would present some more specific example of the type of research that we do. And because I'm the presenter, I thought I present one of my research projects because I think, it's a nice project in the sense that it captures many of the ideas concerning all the themes that you can see on the screen. And this is the project The Bias. Okay, so underpinning, or at the core of this project is the idea that human mobility is central to societies. If you think about it, without mobility we cannot transport goods, we cannot bring provisions to the cities, we cannot go to work, we cannot get an education. So it's very much embedded in our daily lives. So understanding mobility is key to understand societies, and also very important for sustainable development, because mobility is, how we manage it really has an impact on things such as carbon emissions, but also on social sustainability aspects such as accessibility to opportunities and to essential services. So, to demonstrate how central human mobility is in sustainability, I put together this table where we have all the sustainable development goals, and then on the second column, their connection to human mobility, just as evidence of, or a way of articulating how mobility very much relates to the what we consider to be the keys, or the pillars of sustainable development. So the study of mobility has, because it's so important, has obviously been a topic of research for many, many years. And typically, this has been done with what I refer to as traditional data. So this is data from censuses, population registers, administrative sources, or household surveys. And this data is great because it is transparent, it is curated, and normally it is publicly available, not always, but normally. And these are good things because it means that methodologically the data is quite crystal clear. However, with traditional data, we have some problems. So, for example, it is not reliably available in many parts of the world. And if we want to do global analysis, if we want to research countries, specific countries, this data might not always be available. Second disadvantage is that a lot of the time the data is presented in aggregate ways. So we have poor time and spatial resolution. This is a problem because if we want to understand how crisis, shocks, or disruptions to the system affect our mobility patterns, we need way more frequent data, which is available at finer spatial and temporal scales. Unfortunately, with traditional data, we cannot capture these short-term and seasonal temporary patterns of mobility. If there are longitudinal surveys, these are quite rare, and usually longitudinal surveys with large sample sizes are not always available. So we cannot perform this analysis over time. And a key limitation is the fact that the data in censuses, surveys, and other administrative sources has publishing lags of several years, not ideal for the study of mobility responses to these kind of disruptions that I'm talking about, such as, for example, after COVID-19 or after a conflict or a weather event. So this is where digital trace data comes into the game as a revolution full of advantages that can actually overcome many of the limitations that I was talking about. So they offer great geographic coverage, high spatial and temporal resolution at unprecedented levels. We can capture fluctuations. They are very cost effective because the data is already captured for other purposes, might be marketing purposes, might be offering some enhanced experience with a mobile phone app, but the data is collected anyways, so it's very cheap to gather it for research in comparison to, say, a census. And something that is really key is that the data is pretty much instantly available. So it's really has a lot of potential for the study of policy relevant research questions. Mm. Now, I would like to show a couple of examples of how at the Geographic Data Science Lab we have used this type of digital trace data for the study of mobility. So, for example, if you remember about a year ago, there were floods in Valencia, which is the region where I'm from, and a group of us were, we decided to investigate what were the population displacement patterns following these floods. So we collected data from Meta, which is Facebook, Instagram, WhatsApp's parent company. And with this data, we mapped these patterns of population displacement, as you can see on these two maps over here. So the first one shows uh, decrease in purple, increase in orange. So decrease in population with respect to a baseline period. And this was just after the flooding in the first map. And then 2, 3 weeks later, how those patterns of displacement have uh, evolve over time. So we can see, almost on day-to-day basis, really, how these population displacements change. Another example of research using digital trace data was a lot of work that we have done following COVID-19. So, for example, using data from Twitter, we were able to identify patterns of internal migration or relocation of addresses within the UK. But this is just one example of a paper. We have done many more with other colleagues at the Geographic Data Science Lab, where we have used GPS data collected by Meta, again, to understand these patterns of mobility following COVID-19, not just in the UK, but also in multiple Latin American countries. Now, digital trace data is really amazing. It has a lot of potential for the study of this really fine-grained and emergency response type of research. But it also comes with challenges. And the main one that we try to address with this project, the bias, is the presence of biases, precisely. So if you think about it, the whole population, if you think of the whole population, only some people have mobile phones. So, for example, children are already out of data sets where we capture mobility through mobile phone app data. So children are out. Perhaps some older people who are not so familiar with technologies, they are also out. Of the mobile phone users, only some of them are smartphone users. And of those, only some of them are app users. And only some of the app users actually give permission to have their location traced through the app. Okay, if we are thinking of mobile phone data from apps, okay, there could be other types of digital traces. But basically, the message is that of the whole population, we are only capturing a small proportion. And the question is that proportion representative of the overall population? Um, and the answer, based on some preliminary works in the literature, is that this is not the case. So if we, for example, look at the demographic composition of the census versus Facebook, for example, we see that the share of population in different age groups and genders is quite different, right? So some age groups tend to be massively underrepresented through digital trace data, for example. Now, if we have the demographic information of the digital trace data of the users that use the digital technologies, if we have their demographic information, it's okay because we can apply some traditional post-stratification techniques as they would do for a survey to make our sample representative of the underlying population. Just as you can see on this figure here, where you do a weighting of the populations to make them representative of the real population. But what happens when population attributes are unknown? Well, then we need to think a bit harder, okay? And that's precisely what we try to do through the bias. So the bias is a project funded by the Economic and Social Research Council. It's a collaboration between Professor Francisco Ro and myself, and we are getting more people interested. So the collaboration is growing. Hopefully, we can see some of those outputs soon. We work in partnership with Meta, the International Organization for Migration, and Northeastern University. And if you're interested, you can check our project website, which is, I added the link here. Basically, the aim of the project is to create a general framework to detect, quantify, and address biases in digital trace data for the study of human mobility. And I should add here, when there's no demographic attributes of the digital technology users. So we need to do some inference to understand what those biases are and how to correct them. So the project unfolds into two stages. The first part is about detecting and measuring bias, and we have already completed this part. So you can check actually the outputs of the part of this part in our first paper of the project, which I included the reference here. It's currently available as a preprint, also under review in a journal. And basically, what we do is we consider lots of data sources. So, different data sources to understand whether the framework that we are proposing is robust to the choice of data source. And for these data sources, we compute a measure of bias for each of the regions in the UK, although the analysis could also be expanded to other countries. So this bias measure captures the coverage and the population coverage of each digital trace data source. And then based on this measure of bias, we look at how this is distributed across space. And that's key for our analysis because then we can link this measure of bias to different socio-demographic characteristics of the different areas. And in this way, we can use those as covariates to explain the observed levels of bias. And we do that using explainable machine learning. So, for example, if an area has a lot of people over the age of 80, higher than average proportion of people over 80, and it also has a high value of bias, we can this suggests that people over the age of 80 are underrepresented in a given data set. So that's how we work on it. And we test this, as I say, for many different data sources. In the second stage of the project, we address those biases. Okay, so how can we introduce some corrections, some adjustments in the data to make it more faithful to the real movement patterns? And we are currently working on this. This is very much work in progress. So our input data is origin destination flows that are derived from digital trace data. Usually these are obviously subject to some bias, and also they are usually only available in aggregated format. So this is our input, and then we are working on applying some of these adjustments so our output is bias corrected origin destination flows. And this work, we are going to package it as an R package called the bias R. Hopefully by spring 2026, we can present this package already. So this is very much work in progress. I wish I could present more about this second part, but we will have to wait for a couple of months, 3 months, 4 months, I don't know yet, but we are getting there. But this device R software package brings me to talk a bit more about the impact of the GDSL work. So it's not just this package, but uh, we at the lab have been involved in the development of other open source software packages. And here are some of the perhaps most well-known ones. Others are a bit smaller, but Contextili, I'm pretty sure that some of us in this call are quite familiar with this one, as well as Paisal. We have members of the lab that have contributed to Paisal. Recently, one of our PhD students launched City2Graph, which is a package, Python package that allows you to take geodata frames and transform them into networks, into graph format. And this one is a much smaller package that I have been involved with, and it's for the creation of hierarchical heat maps, so visualizations in R. So as well as open software, we are also quite active in the production of open source materials for education. And if you want to check those out, you can follow this address, this URL, which will take you to our GDSL GitHub repo, where actually we post a lot of our materials that we teach in our master's courses so that other educators from other institutions can also benefit from it and hopefully also contribute to our materials by making them better, really. The lab doesn't work in isolation. We very much like working in partnership with external institutions. So here I listed some of them. Um, um, uh, in the UK, as well as many of you may know, there's it's pretty good environment because for creating research impact, because universities very much recognize this type of work. So we are incentivized to create these types of partnerships. Uh, in the lab, we host two national data services, so the Geographic Data Geodata service and also Imago, which is the data service for imagery. So Imago is about making satellite imagery more useful across researchers, but also policy. And if you want to learn more about this data service, you can check their project website. I'm not sure if there are any data products available yet, but I know there will be available very, very soon. So you're welcome to keep an eye on their updates on the website. And this is not just a University of Liverpool thing, but it's a cross-institutional data service actually with the University of Manchester, Newcastle, and Harvard. A lot of our work is, as I say, through partnerships. So many of us are interested in making our our research useful for policymakers. And recently, I've included here some recent reports that we have written in collaboration with external institutions, such as the International Organization for Migration or Liverpool City Region, for whom we created a dashboard to better understand road safety data, and also with the UN division ECLAC, which is the Economic Commission for Latin America and the Caribbean, where we produced a report looking at these patterns of mobility following COVID-19 in multiple Latin American countries. And this is my last slide, which is about cross-institutional consortia that we are involved with. And this will lead me very naturally to hand over to Susie, who will present the second part of this seminar. So Susie works at the Social Health Hub, which is one of our cross-institutional collaborations. Social Health Hub is one of the multiple hubs within the mental health platform in the UK. And I'm just going to stop here and let her explain more about this. Thank you. So I'll stop sharing and let Susie continue.
Thanks, Carmen. Hi, everyone. I'm Suzy Deng. I am a postdoctoral researcher at the GDSL. And now I'm going to share my project I'm doing now. I need to share my PowerPoint. Can you see that? So this project is within the Social Health Hub, which is one of the 6 hubs within the mental health platform founded by UKRI. And this project and this hub it focuses on non-medical factors influencing severe mental illnesses, including how people are born, grow, work, live, and age. And these projects and I'm working on the first work stream of the Social Health Hub, and this work stream aims to investigate the complex associations between various place-based social determinants and severe mental illnesses. So why do we study place-based determinants? So I want to begin this story by looking at through a geographer's lens. So this is, you can see a map shows the prevalence of depression across England in 2022. And the different shades represent how each area compares to the national average prevalence, from very low prevalence in dark green to very high prevalence in dark purple, and gray represent the national average. And what's immediately striking in this map is that the depression does not occur randomly across the country, and there are some very interesting geography patterns. For example, you can notice some clusters of very low prevalence and very high prevalence. For example, for clusters of high prevalence, you can see in Liverpool and Newcastle, Midlands, and some coastal communities. And and in London, you can notice like the prevalence of depression is quite low. And it's actually really hard to notice even 1 pixel of purple within the city. So this leads us to think about the question, why do this cluster exist? And in addition, you probably notice some high contrast like the neighboring areas have quite different prevalence of depression. And why do this high contrast exist? And this will lead us to think about a deeper question. Does the place where we live actually make us depressed? I know people may argue that, well, this is just a pattern, reflects the pattern of socioeconomic inequalities, or let's say aerial deprivation. But I would say research has showed that deprivation can only explain 3% to 90 to 39% of these variations across the country. So there must be more hidden factors within the places within the places we live that shape our mental health in a way that we haven't understand yet. So let me give you some real life examples of place-based factors that might influence mental health. So first of all, think about how easy is your daily commute from home. If you live really far, then like long stressful journey can really make you stressful and can really take a toll on your mental health and well-being. And also think about the quality of housing. Is your housing warm, safe, and stable? And also think about the ease of access to mental health services, especially when you need support. And also, how about your neighbors? How friendly and supportive are your neighbors? And is your neighborhood quiet and peaceful, or constantly noisy or disruptive? And also, like, can you easily access to public facilities like parks, libraries, or community centers? And all these factors are just some examples, and this everyday environmental and social factors may seem very small in isolation, but together they shape our daily experiences and also our lifestyles. Over time, these factors can shape our mental health. That's why we want to understand place-based social factors within the environmental research. Indeed, there are lots of literature on how different place-based social factors influence mental health, such as ambient air pollution, green space, air pollution, commuting, aerial deprivation, housing. However, most existing studies focused on a single factor or at best very limited set of factors. But in reality, the place where we live can be very complex. And also their effects on our mental health can also be very complex. For example, a neighborhood with excellent transport links might also suffer from poor air quality, and or area with lots of green space might also have really bad housing quality. So when we look at social or environmental factors in isolation, we could risk overstating or understating the true impact of some specific conditions on mental health. That's why we need to consider a broad range of social factors together to gain a more comprehensive understanding of how place influence mental health. So this project is designed to help fill this gap. And from this project, we hope to answer some key questions like how do different social factors affect people with severe mental illnesses? Are some factors more influential than others? And do these associations vary depending on the type of mental illnesses, age, gender, or migration histories? So in plain language, for example, are these associations stronger or weaker for different types of illnesses, including depression, schizophrenia, bipolar disorder, and are these associations stronger or weaker for younger people, older people, for women or men, for people who born in the UK or those who born overseas. So how do we actually do this research to answer these questions? We initially we plan to get mental health data from a national database. However, that database cannot provide geography locations for their patients. That makes it impossible to link the health outcomes with place-based indicators. So we just changed the strategy, and we are getting mental health data from three mental health services or under NHS. So this is the distribution of the three NHS trusts. Although we only get data from three NHS trusts, but these three trusts can cover around 5 million people in their catchment area. And from these health records, we will identify individuals who have been clinically diagnosed with depression, schizophrenia, or bipolar disorder. This makes our mental health outcomes really validated, and these health outcomes will also this health records will also contain like rich personal and family background information, so that we can control personal variables in our analysis. And one of the highlights of this project is that we co-developed a framework of place-based social factors in collaboration with mental health experts and an advisory panel of people with lived experience of mental illnesses. And we are developing this framework, and we hope to publish this framework as a geography index, as an open resources, and hopefully these resources can be used by future mental health research. And this framework consists of 8 domains, and each of the domain capturing a different dimension of the social environment. And within each domain, there are a number of specific indicators. Here, I just put some examples for each domain, but actually within each domain, we have a number of indicators. And then and these indicators can represent measurable aspects of the place where we live. And the 8 domains include socioeconomic disadvantages, social capital and connectedness, crime and disorder, environmental hazards, housing quality and overcrowding, accessibility of mental health promoting facilities, accessibility of mental health constraining facilities, and spatial isolation. By mapping all of these place-based place-based factors together and then linking them to individuals' mental health records, we aim to build a comprehensive picture of how different aspects of place interact to influence mental health outcomes. And this work is still ongoing, and now I'm not able to present any results, but hopefully I can bring I can bring some results later next year. So at last of my presentation, I just want to highlight the implication of this research. So first of all, the results from this project can provide evidence on which social factors matter most, and these can become actionable targets for policy and planning. And second, we hope these findings can help guide smarter and more joined-up services, where healthcare and social care work together more efficiently, and this can lead to better outcomes and lower costs for the services of mental illnesses. And sadly, this project can support better care for people living with severe mental illnesses by recognizing and corresponding to their social needs, not just their clinical needs. And ultimately, we hope this work can contribute to build a society that promotes mental health for everyone through better environment, stronger communities, and a fairer system. That's all I want to share today. Thank you so much for listening. And now it's a question.
Yeah, thanks. Thank you very much. Thank you, Carmen and Susie. Yeah, now we have 7 minutes for questions and discussions. Any questions? Yeah, you can raise your hand, then I will unmute you. Questions, comments? Anyone? No? Okay. Yeah, okay. Oh, Rob. Let me... Hi. You should be able to talk now, Rob.
Yes.
Yeah.
Yes, thanks. So I posted my question also in the Q&A, but I
yeah.
can read it. Thanks, Carmen and Susie, for your great presentations. My question is for Susie. So the 2022 map that you showed of England with depression, how was that created? What were the sources? I was wondering.
I just borrowed this map from another research, and the source, I believe, is from NHS. And there's a platform, it's called NHS Digital, and they publish prevalence of some mental health outcomes every year. And I think that in my mind, they just get the data from that platform.
I was just curious to know whether this was done through interviews with whom? With municipalities or with on other level, let's say other kind of level with maybe practitioners or whatsoever.
No, it's not. It's from official resource. I think it's impossible to estimate the prevalence from some localized services. That's not enough. The statistical power is not enough to produce such kind of national level data.
Okay. Thanks.
Thank you. Thank you, Robert. Any other questions? Yeah, follow the Robert's question. Yeah, I'm wondering, like, questions for Susie. So I'm wondering, what kinds of methods you would like to, analyze these contributions of place-based factors to mental health. Because you mentioned those factors, but you maybe I'm not sure whether I missed that methods part.
Do you mean how do I develop those indicators, or how do I link those indicators to mental health outcomes?
Yeah. Not. I think how to link to the mental health.
So from mental health, so from the electronic health records, which is a data source, we have residential locations of each patient, and we can just link the place-based factors through everyone's home address. And then in terms of the once we link them up, then we can use some statistical methods to test the associations. But the specific statistical methods is still in discussion. But hopefully we will use deep learning, because there are so many place-based indicators. And we really need a calculation efficient way to find out the association. And yeah.
Okay, thank you. So there's a question here from AGILE. That question is for Carmen, I think. So currently there are very few open human mobility datasets that a researcher committee can apply de-bias techniques to. Do you plan to release any synthetic data based on data sources you have access to with the de-bias R?
Thanks for that question, Egor. So that's a very good question, actually, because you're right that there are not many openly available data sources like this, and perhaps a great example of it would be the Spanish open mobility data that Egor has done a lot of work on. Right, so we actually plan to release some synthetic data, which will be published with this package, the BiasR, as a toy data set that can be used for illustration of how the package can be used, and also for our own purposes to test the different package functions. So yes, that will be released together with the package.
Okay, thank you. Thanks, everyone. I think, if you have any more questions, please feel free to contact our speakers afterwards. Thanks again to our speakers and to all of you for being here. Our next webinar will take place in January 2026, led by KU Leuven. So please keep an eye on the mailing list for details. And we look forward to seeing you at the next session. So take care and enjoy the rest of the day.
Thanks
Bye.
so much. Thank you for the
everyone.
invitation.
Bye bye.
Cheers.
Bye.